Hi, we're here at the World Health Summit 2026, where leaders are reimagining Africa's health systems through innovation, integration, and interdependence. In this special conversation, we bring together key voices at the forefront of this transformation. Together, they explore what it truly means to build resilient, equitable, and future-ready health systems across Africa, and what it will take to turn this vision into action. I'm your host, Benson Githaiga, and this is the future of health in Africa. My name is Benson Githaiga from the Graduate School of Media and Communications, Aga Khan University. I'm here with President Shabuddin. How are you?
I'm very good, Benson, and thank you so much for inviting me.
What's your energy for the conference?
You know, my energy for the conference is really high.
Okay.
I'm really positive today. Just to be able to get all these folks together, the top policymakers, top representatives of international and national organizations, right? I mean, that is wonderful.
Yeah.
What we said at the opening, and the tone has been set. What did we say in the morning? We said, we will not have a conference where we will just pass blame to X, Y, and Z.
Yes.
We will talk about what we in Africa can do and take charge of our own destiny, shape our own destiny when it comes to healthcare and all the other social indicators. So I mean, I feel terrific to know that there are 20 ministers and so many strong participants who are willing to sit together, work together, and come out with a collective view on how we should proceed.
Give me a reason why the World Health Summit exists.
The World Health Summit exists to bring together people from different regions in the world and from different stakeholder views. There is a World Health Organization, but that's a membership organization for nations. So the private industry is not in there, academia is not in there, and this is needed to push health on a global scale, because you can't do it without academic insight, you can't do it without the private sector and the industry, you can't do it without civil society.
As the provost for the Aga Khan University, why is this conference very important, the World Health Summit? Why is it important for you?
So I think it's important for us because it underpins our key principles of impact, quality, relevance, and access. So we're talking about accessible health systems for all. We're talking about relevance, so basically African countries designing and developing health systems that are impactful for their own populations and not being told what to do, right?
Yeah.
So in a global health context, it's taking back ownership of health systems. In terms of impact, you're going to look at a lot of different issues throughout the conference that will provide impactful policy solutions for global health challenges. Right now, there's a plenary going on about polycrises. So we can't think about crises individually. We have to think about sort of collectively what we can do. And of course, the quality and the quality of care and improving that for all Kenyans. So AKU is really well positioned to be a host for the World Health Summit because our goals, our vision, and our missions and our core principles are aligned.
So I think this conference is going to be like many other conferences, an opportunity to discuss, debate, exchange ideas. No single conference can change the world. But it can start a movement. It can start a discussion and dialogue. But what I was particularly encouraged by this morning was to see how engaged the president of Kenya was, how the leadership from many African countries and agencies was aligned behind the global challenges that we have. And then importantly, we discussed solutions. So it's one thing to have a diagnostic, is to just admire the problem and forever talk about how difficult and challenging things are. But it's quite another thing to come up with indigenous solutions, whether they come from innovations, where they come from new thinking, where they come from revolutionary ideas that will bridge the equity gap and importantly allows the region, particularly Africa, to stand on its feet and confront the challenges that it confronts right now with global development assistance becoming very transactional, very bilateral, and not at all focused on reducing some of the disparities that we've all been fighting for.
The theme of the conference is about reimagining health systems and about, partnership and intersectoral collaboration, etc., which is extremely important for Africa. A lot of the, what we call global issues, health issues or priorities are actually in outside, the Western world. They're actually in Africa, in South Asia, in Latin America, in the Caribbean, in the island states. So that's why it's important, because this is where we need to meet. These are the people we need to work with right here, because they are the ones concerned by these issues. And I think the ownership is with the countries. The countries really have to be in full charge and ownership of the solutions that will help them address many of these global health challenges. So there's a lot of focus in this meeting on, not health systems, strengthening health systems for what? Strengthening health systems so that they are resilient, and not to use just buzzwords, so that they will be able to really respond in a very effective way, very efficient, very cost-effective to crises.
Quick one, what do you expect to gain after 3 days of the summit?
So I'm actually more interested in the finance, the health finance. I really want to hear, especially from the ministry, what are they going to do about our mortality, especially in children? They are dying too much, and they are not supposed to be dying. And what about things that is beyond the basic, like what about nutrition? What are they going to do about nutrition? We do have children now survive, and how and what can we do to make them thrive? And then after that, what are we going to do about disability? What about the children who is suffering, the deaf children, or the children with disability? So what, beyond the hospital, beyond the doctors, what are other role a player in this stakeholder in this area are going to do about it?
I'm speaking on women health, and specifically on integration of women health into, or NCD integration into women health. We are as a civil society network in the region, in the Eastern Mediterranean region of 22 countries. There is a number of countries from Africa, North Africa. We are advocating for integration of non-communicable diseases in most of the programs. So we're talking about women health, child health, elderly health, all others. Why? Why? Because non-communicable disease is rising, and the burden of non-communicable diseases is rising globally, as well as in Africa and in our region in Middle East. And the issue of sustainability of the health system. So most of the health system, even in a well or highly developed country, will not be able to sustain a quality and effective NCD care unless we think of integration of the non-communicable disease in all programs currently available. So if we are talking about the session, we are when we talk about women health, there is a rising incidence of non-communicable disease in women. So if we take it in cancer, we have a rising incidence of cancer in Africa, of breast cancer, cervical cancer, and we need to take that into issue of what is the best approach for this cancer. Definitely, it's the prevention. So the approach of prevention. When we talk about prevention, there is a lot of already available evidence-based and cost-effective intervention that can be applied and to reduce the cost and to reduce the suffering of the women, reduce suffering of the family, and the cost for the health system.